Hello everyone, my name is Sharika Campbell and I am a student at the Baptist Kettering Skills Training Center, Skilled Area Allied Healthcare Level 2 Cluster 2. Today I will be demonstrating the correct procedure for skin assessment. The skin is the largest organ in the body. It covers the entire external surfaces. The skin has many different functions, which includes thermoregulation, metabolic function, sensation, and protection. The skin is divided into two main regions, namely the epidermis and the dermis. Both provides a distinctive role in the overall function of the body. The skin is also the first light of microorganisms. Certain diseases manifest its symptoms through the changes of the skin. This gives us diagnostic clues of our clients' underlying conditions. The equipment needed for this assessment are a rubbing alcohol, a book and a pen, some cotton balls, a tape measure, a glucometer, and some test strips, a pen light, a pair of gloves, a mask, and a gown. Before going into the client's room, I'll be donning my PPEs. First, I'm going to start with my gown. And then I'm going to be donning my mask, holding it at this point, covering my ears. And then I'm going to be donning my gloves. Hello, my name is Sharika Campbell and I am a nursing student for today. What is your name?
My name is Cameron Williams.
And your date of birth, Cameron Williams?
The 9 to 4 of the 8th, August 27.
Okay. Is it okay for me to check your wristband?
Sure.
Just verify your name. Okay, what would you prefer me call you?
You call me Mr. Williams.
Okay, Mr. Williams, today I'm going to be doing a skin assessment where I'm going to be palpating and visualizing your skin. Is that okay with you?
Yeah, sure.
I'm going to be checking for abnormalities, any skin disease that can cause future complications, and also going to be checking for discoloration of your skin, etc., any skin lesion, and all of those. That's okay with you, right? Okay. I'm also going to be checking your blood sugar level. Is that okay with you? Okay, so I'm going to be wiping your finger with just a little bit of alcohol, just to get rid of any debris that are on the fingers. And then I'm going to allow it to air dry for about 2 seconds. Alright? And then I'm using seal needle. And I'm going to adjust the prick. I don't want to give you a deep prick.
Okay, sure.
Alright. Okay, just waiting for the result, Mr. Williams. And your blood sugar level states that it's 8.0. This means that you are diabetic. So I'm going to be documenting this finding, and you'll be referred to the necessary health professionals as needed. Alright? Just a little bit of safe, healthy tips. Stay away from as much sugar as possible. Try to exercise. eat as healthy as you can and drink a lot of water so you stay hydrated. Alright? Is there any questions for me?
No.
Okay. So I'm gonna be proceeding by doing the skin assessment. That's okay with you?
Sure.
Alright. Knock knock.
Okay.
Okay, I'm closing the door to protect the patient's privacy, and I'm also going to be drawing the curtains. Okay, Mr. Williams, for the assessment, I'm going to be starting with the head. All right? I'm going to make sure that there's no pressure on you just to protect your privacy. So I'm going to be checking the texture of your hair. I'm going to check in the scalp to make sure that there's no lysis or any other parasites. I'm checking the scalp to see if there's any fungal infection. Looking good so far. The eyebrows, the hairs are evenly distributed. And I'm going to be having a look in your eyes. I'm looking for any discoloration in your eyes because if there's any discoloration, it could be a sign of skin cancer. Okay? Let me check on your nose. And now I'm going to be inspecting your mouth. So I'm going to be asking you to open your mouth a little. Alright? I'm going to be checking for tooth decay. If you have any gum disease, any mouth ulcer. Okay, I'm going to ask you to stick your tongue out a little bit. I'm checking if you have any thrush. I haven't seen any of those. Your lips are nice and moist, which is good. Okay, and I'm going to be checking your ears. I'm checking to see if there's any inflammation in your ears. I see where you have a piercing in this ear. And I'm also going to be doing the same thing to this ear. I'm checking for inflammation. And I haven't seen any so far. So you have 2 piercings so far.
Yes.
I'm going to be checking your neck. I'm checking for moles, any lesions such as insect bites, any bruises, any scrapes. I haven't seen any of those. Okay, now I'm going to be doing a skin trigger. I'm going to be pinching the skin. And I see where it goes down really fast, so it's a sign that you are well hydrated. If I had pinched the skin and it goes down slowly, it would be a sign that you are dehydrated. Alright?
Okay.
So I'm going to be inspecting the stress. I see that the hairs are okay. There's no discoloration. Okay. And I'm going to be inspecting your arm down to your hands. Okay, I see where you have a mark here. Let me just measure this to see how long it is. Looks like a scar. And it is about 4 inches. I'll be documenting the findings, alright?
Okay.
So I'm going to be checking the temperature of your skin. I'm using the back of my hands because the back of my hands tends to absorb the temperature better than the palm of my hand because my palm of my hand is thick. Alright?
Okay.
So I'm going to be checking for any and I'm going to be doing the same thing for the other hand. I see where you have a long tattoo. Let me measure this one. And this finding will be documented, alright?
Okay.
So your tattoo is 20 inches. I'm checking the temperature of your hand. Checking for lesions, insect bites, scrapes, any burns. I haven't seen any of those. Checking the fingers. Haven't seen any pluggings. Alright. Okay, Mr. Williams, I'm going to proceed to your foot. First, I'm going to be checking the temperature of each foot. And it's warm. I'm going to be checking your knees to see if you have any scars, any bruises. And I'm going to be checking for edema. Okay, your skin did a sunk, so there's no sign of edema. If I had sunk the foot or put pressure on your foot and it sank a little bit, then it would be a sign of edema. In this case, you have no sign of edema. Alright?
Okay.
Now I'm going to be inspecting your foot. I'm going to be inspecting the toes. When I put pressure on, it didn't change. And I'm going to be inspecting inside your toe. Okay, your toes In the middle of this one, it shows where you have some white. This could be a sign of athlete foot. All right.
Okay.
Now I'm going to be checking the heel of your foot. I see where you have some cracks. I'll be documenting these findings. All right.
Okay.
And I'll be doing the same with this foot. I'm going to check the temperature of your foot. And I'll be checking for any cirrhosis, any insect bites, any scrapes, any burns. I haven't seen any of those. And I'll be doing the same thing with your toe. Alright. So Mr. Williams, I would like to inspect your back. Alright, so I'll be turning you into a similar to a recovery position. We're going to go on your side. Alright?
Okay.
Alright. Okay, I'm inspecting your back. I see where you have some moles in your back. Let me just measure one of them. So one is about 2 inches big. That's the biggest one. The others are really small. Okay, I'm just checking the bony parts of your back. I'm checking to see if there's any sign of pressure ulcer. So in case you feel it like hurts a little bit, you can say so. All right?
Okay.
And there's no hurt, right?
No.
So there's no sign of pressure ulcers. I'm turning you on your back. Okay. Okay, Mr. Williams, that's the end of your assessment. The doctor will visit you in about 2 more minutes, and then after which I will check on you. All right?
Okay.
Is there any questions that you'd like to ask me?
No, no question at this time.
All right, so I'll see you after the doctor's visit, all right?
Okay, no.
Okay, we've come to the end of my assessment. Now I'm going to be doffing my PPEs. First, I'm going to be taking off my gloves. And then I'm going to be using an index finger to remove the other one. And I'm going to dispose of these. And since the ties on the gown are the cleanest part, I'm going to untie them. And I'm going to shake my shoulders to get the gown off, making sure that it's not touching any parts of me. And now I'm going to fold it. And I'm going to be discarding it. And now I'm going to be performing hand hygiene. And I'm going to be removing